Let's just start with the latest news. Probably you heard about the shipwreck in Turkey in Van Lake, and a lot of Afghan refugees believed to be dead, and some of the bodies returned to home to Afghanistan. From the point of view of a humanitarian organization like IRC, what is the solution for these such disastrous incidents to avoid death and avoid and save lives?
Well, the ultimate solution would be to have some sort of peace agreement here so people, and economic opportunity as well, so people wouldn't feel the need to flee the country. You know, the interim solution is for countries that have the ability to take in people that are fleeing poverty and war.
Yeah, so let's talk about COVID outbreak in Afghanistan. When we see COVID outbreak overall around the globe, also in the US, a lot of healthcare workers are women. And also in Afghanistan, probably a lot of women are serving, but I see the numbers are underreported. We don't even see how many victims are women or how many healthcare days there are women. It's mostly they talk about men. It's like they don't even talk about women. What is your thoughts and how are you looking at it?
Yeah, so there's a few issues with that. Afghanistan actually isn't like the rest of the world, unfortunately, which means that there are very few healthcare workers that are women here. So according to the Humanitarian Response Plan for Afghanistan, only 2% of doctors are women, and I believe it is somewhere between 15 and 20% of other healthcare workers. And this creates a huge barrier to women accessing health facilities in Afghanistan because they need to see female healthcare workers in many cases. So it could be that the COVID is just as prevalent in women, but we don't see it because they're not accessing healthcare facilities. It also relates to women just, sorry, there's no death registry, mandatory death registry here in Afghanistan. So we don't know ultimately who is dying from COVID and who isn't. In the beginning, we also had a shortage of tests, so they were only testing those people that were most likely to have it. So people returning from Iran, say, or healthcare workers. And again, that's predominantly men. And so, of course, they're going back to their families, and their families could be getting infected, but maybe they're not accessing the healthcare facilities. So I think that it's hard to say for sure that men are getting the disease more than women here.
That's right. Also, we spoke about there's a new survey on women and COVID, how women are impacted, or another survey you have done with UN Women. Tell me about the survey. What is that?
So there is a survey that UN Women has done across different countries in Asia. But the way that survey mainly was being done was through SMS messaging and then having people go online to take the survey. And so when we were discussing it here with UN Women, we said that the majority of Afghan women don't have access to phones or the internet. And only about 30% of Afghan women are literate. So they wouldn't be able to take the online survey, even if they had access to technology. And so we have over 600 female staff that are in the districts in many of the provinces, and we had them do face-to-face surveys to make sure that different types of women were included in the survey. So while the regional survey has been launched, they're still inputting all of the data from the offline survey, so I don't have the results from that, but happy to share them with you when we do have the results.
That's great. Good news. But at least you're reaching out to find out this information, which is critical and important. But I was also talking on distance learning, how they are reaching out to students. And they say that in a family, there's one phone, they send the information through WhatsApp. So they try to reach out the material or send them the material so the children can get back on track, which is tough. So IRC has been active during COVID. How COVID impacted your humanitarian efforts in reaching out people and saving lives?
So it's impacted greatly. Of course, we had to come up with a whole new way of doing business, and to make sure that we're also keeping not only our staff safe, but our clients safe as well. And yet we have greatly expanded our programming to directly address COVID. So, for example, we are now training healthcare workers in infection prevention and control. We have community healthcare workers, the majority of which are women, going out to the households so they can reach women that don't have access to other forms of information. And we know that these women are the primary caregivers in their household. So if their family is not going to the healthcare facility, or if one isn't available, then they're the ones that are going to have to take care of them. So we're training them and providing them with hygiene materials and other things to keep them safe. Also providing soap and hand washing facilities for public spaces. And then one of the biggest things that we're doing is increasing our protection programming, because we know globally and we know in Afghanistan that gender-based violence is increasing as people are losing their jobs and confined to their homes.
Yeah, and let's talk a little bit about testing, how the testing is happening, how people are coming forward, because sometimes people in Afghanistan, culturally, if they're sick, they feel ashamed. If somebody is sick, they're like, okay, if I tell them that someone else will be like offended, something like that, culturally sensitive thing.
Yeah.
How you reach out and do the testing, and how people are taking it. Do they take it serious? They come to you or you go to them, how it works?
Yeah, so for the testing, it is very difficult because there is a lot of stigmatism against people, particularly in rural communities as well, or minorities or people returning from Iran. So they don't want to get tested. So one of the things that we're trying to address is that, and the hospitals and healthcare facilities don't have the capacity to treat everyone. And so there is a message that if you can be treated at home, or if you can recover at home, do that. And so one of the things that we're trying to do is make sure that we're giving people the tools that they need to do that. And yet at the same time, with that message, we also are a bit concerned that, telling women that they need to stay home when they might be home with somebody that is harming them, we need to balance that message. So there is only a certain capacity here in country to test so many tests per day. And at the peak, people have been, I mean, we've staff to cope. And we've also been, turned away when we've tried to get help at some point when the hospitals were at capacity. So, it's a struggle.
Yeah, so how do you streamline your work with frontline workers, responders? So basically in the US as well, a lot of frontline responders, doctors, healthcare workers, they get sick. How they're carrying IRC mission to save lives? Yes.
So we make sure that all of our staff have PPE, appropriate PPE, and training, and retraining, because the social distancing and the washing of the hands are the two very clear things that will help protect them aside from the PPE. And before we will send any of our staff out to do these activities within the community, we make sure that they know how to not only protect themselves, but ensure that our clients are protected as well.
Yeah, so I was looking for how widely you're covering Afghanistan. beyond Kabul, and IRC is active with other parts of Afghanistan, and I mean like overall, because COVID is making, like building more barriers to your work. So how you reach out?
So we're in Helmand, Herat, Badghis, Nangarhar, Lakhman, Logar, Paktian Host. So east, west, and south. And not just in the cities, but out in the districts as well, because it's very important that the rural communities are reached.
Yeah, just last question about the refugees. And there was another news on IRC that COVID is impacting moving of refugees, and it is because of restriction of COVID, and they're more vulnerable because they're choosing more dangerous routes. What are your thoughts about Afghan refugees that they're taking such a risk and they want to just run away from conflict and violence because obviously they have no other choice?
Yes, it's not only conflict and violence. So if you use the global standard of $1.25 per day, more than 80% of Afghans are living underneath the poverty line. And that was before COVID. So if your choice is between risking a dangerous trip on a rickety boat or getting captured or starving to death, you know, it's not really a choice. One might be certain death and one is a chance at hope. So again, I come back to, we have to resolve the issues within the country, and those countries that can need to also support Afghanistan.
Last question, the peace process. Let's say that peace process succeeds. Does it impact your work? And also US troops are leaving as well. How does it impact your work?
It depends on how the peace process succeeds. So if it succeeds by foregoing women's rights, then it's going to have a huge impact on a lot of our programming for women and girls. If it succeeds where women still have their rights and we can continue with activities, it will be great because we'll be able to reach more people because more areas will open up. And then it also, if it succeeds, that means that more people will be willing to invest in Afghanistan and that there'll be more opportunities here for the Afghan people. And, you know, hopefully eventually there won't be a need for us.
Very good. Thank you so much, Vicki. It's very nice to talk to you. I think we cover everything, right?
Great.
Thank you so much.